Welcome to the first of 2025's education sessions. Um, I'm Chris Carrigan. I'm the data advisor for Use My Data. We normally put these on once every 3 weeks. I think the next one is in a couple of weeks. And just as a heads up, in the run up to the conference in June, we're going to be using some of these sessions to bring in some of the exhibitors and some of the presenters you might be hearing at the conference for you to give them a listen and ask questions and maybe steer them about what they might want to present at the conference, particularly the exhibitors, what you might want to hear from them at the conference. So we'll be using some of these education sessions in the run up to the conference to do that as well as running regular topics. So the format for today, for those who've been before, is the usual format. It's around 20 minutes on the topic to hear about something. The rest of the time is for your discussion, your questions and answers. So we should have plenty of time to cover those questions. I've mentioned if you can keep your microphones on mute at the moment, that would be helpful, but you can unmute yourselves whenever you want when we get to the question and answer. So I'll leave that all up to you. If you want to raise a question or make a point during the talk, it's probably easier just to use the chat function where you can type things in, and then we've got a record of those when we get to the question and answers. You could always use the chat at any point to raise a point, to put a link in, or other things people do. Your cameras are on. If you're struggling with connection speed, feel free to turn your cameras off. If you ask a question at some point, it's good to see who you are, but if you're struggling with bandwidth, don't worry, just turn your cameras off. That's usually the best thing to do. I've mentioned that we record this session, we'll put it on our website afterwards. We tend not to include the Q&A part afterwards, so feel free to ask any question you like. But we started to produce things like transcripts, which can be useful as well. So we have a record of what has been asked and some of the answers as best we can. And thank you to Jackie, who's on Google, helps with that immensely. If you do want to ask a question when we get to the Q&A, keep it short, keep it focused, so we can get as many questions in as possible, because the hour goes really quickly. And the last point I always make is it's quite possible that people will have different opinions and different views on particular topics. That's not the problem. You can always disagree, but please don't do it in a disagreeable way. So I think that's enough from me. I think we should get started. So at this point, I'm going to ask Alexis and Amy to introduce themselves, say who we are, and introduce the topic of big data for complex disease.
Brilliant.
Alexis.
Thanks, Chris. Good morning, everyone. Nice to see some familiar faces and some new faces. I'm Alexis Webb. I am a Senior Program Manager at Health Data Research UK, and I look after the Big Data for Complex Disease driver program, which I'm going to be telling you a little bit more about shortly, but I just want my hand over to my colleague Amy to introduce herself as well.
Thanks, Alexis. Hi, everyone. Lovely to see you this morning. So yes, my name is Amy, and I'm a Public and Patient Involvement and Engagement, or PPIE for short, manager at Health Data Research UK. So I support involving and engaging the public within the Big Data for Complex Disease driver program.
Brilliant. And I've attempted to share my slides. Hopefully you can see all of those now. Brilliant. Right, so let's get started. So I'm going to start with giving you a bit of background about Health Data Research UK, for those of you who may not be familiar with this organization. So the mission of Health Data Research UK is to unite the UK's health data to enable discoveries that improve people's lives. And our vision is for large-scale data and advanced analytics to benefit every patient interaction, clinical trial, and biomedical discovery, and to overall enhance public health. The way we will achieve our vision and mission, we have a set of 5-year objectives. So Health Data Research UK, we are in our second quinquennium or 5-year funding period, and that started in 2023, and that will be running through until the end of March 2028. So This is the second 5-year funding period for Health Data Research UK, and we are supported by a group of different funders, including organizations like UKRI, and the Medical Research Council, but also charities like the British Heart Foundation and Cancer Research UK. So we will achieve our vision and our mission using these 3 objectives over the next 5 years. So one is to accelerate trustworthy data use by sorting the data. The second is to improve people's lives by unlocking the power of data. And the third is to shape the future of health data research. And today's presentation is kind of covering all of them, but I'll go into a bit more detail about what I mean by sorting the data and how we're trying to unlock the power of the data through our research driver programs. So unlocking the power of data, how are we going to do that? So one of the things that we do as Health Data Research UK, as a kind of national health data institute, is we value people with diverse perspectives, and we are wanting to work in an open way, in a transparent way, to advance scientific discovery and deliver patient and public benefit. And that means that patients and the public really are contributing to every step along this process to unlock the power of data. So you can see the orange bubbles there really go all the way from, actually finding and identifying the data that we can use to answer important research questions, all the way through to creating data insights and making policy changes that improve health in a data-driven way. And we work with lots of different types of individuals, from folks on the more analytical side of things who are developing software, who are architects that are designing servers, data access systems, secure data environments. We work with legal and ethical bodies and experts, alongside folks who are key in understanding information governance and how we can ethically find, access, link, curate, analyze data. Then we have our researchers and our statisticians, our data analysts who are working with these data, and clinicians and practitioners who are really informing the types of questions that we can answer with the data to really deliver clinical benefit and benefit to patients and the public. And then obviously project management and operational leadership, which is where Amy and I sit in the organization to kind of bring all of these people together and to help things run and move forward. So part of the 5-year funding period that we're in at the moment, Health Data Research UK proposed to our funders that one of the ways that we were going to accelerate trustworthy data use by sorting the data and unlock the power of data through research and empowering researchers is through our collaborative research driver programs, which are highlighted on this slide. So we have 5 research driver programs: molecules to health records, inflammation and immunity, medicines and acute and chronic care, social and environmental determinants of health, and then big data for complex disease, which I'm going to go into a bit more detail on in a second. And the point of these driver programs is really to test the system and to make sure that what is necessary to be in place in order for us to conduct the health data research that we would like to see, that the infrastructure and the other aspects of the ecosystem are there to deliver the diverse research needs. And one way you can think about how we're testing the system is being able to access the necessary data through the national secure data environments that are available through the devolved nations. So, for example, NHS England has a secure data environment where we can apply to access health data. And so these driver programs are interdisciplinary. We work together, and we're really motivated by the FAIR principles and the five safes. So that's safe data, safe projects, safe people, and the other two are dropping off. Safe outputs, and there's one more. Apologies. And then we are trying to think about how we can also use the FAIR principles, so for wider data reuse across the wider research community to deliver health and care impact. So now some more details around big data for complex disease. So this is one of 5 driver programs. We are working to bring together whole population linked health data. So this is data across all 4 nations of the UK, housed within the national secure data environments. And the program is particularly interested in the prevention, diagnosis, and treatment of cancer, cardiovascular disease, and other complex diseases, with the 3 aims of thinking about predicting the trajectory of disease and risk of disease, then to understand interrelationships between diseases, so including kind of how a cancer diagnosis might impact future cardiovascular disease diagnosis or treatment, and vice versa. And then finally, to better understand the impacts of inequalities associated with receiving a disease diagnosis, so we can better understand those impacts and try and alleviate any negative effects. The way the program is structured, we have scientific program directors who sit within UK universities. We have our management team, which sits within Health Data Research UK, and then our PPIE contributors who also contribute to the overall structure of the program. Then the itself, we have kind of at the top layer, you can think about it's the actual data. So this is the de-identified, linked, and longitudinal population health data that are sitting across those national SDEs. So within NHS England, the SAIL data bank in Wales, the Scottish Safe Haven, and the the Northern Ireland Honest Broker Service in Northern Ireland. And then underneath that, just bringing the data together, we have research program work streams that are focused on those 3 areas that I mentioned. So risk and disease prediction, relationships between diseases, and the impacts of inequalities. And then individual projects then sit under each of those work streams that are being run by PhD students and fellows that have been funded through the program. And we also have a wider consortium of researchers who are interested in using these data, and they can also apply for access. I'm not going to spend a lot of time on these slides just because there's a lot of detail on them, but I'll make sure that they're shared with you afterwards, and Chris can send them to you. But just to say that we have a variety of research projects that are being delivered by the fellows and the students as part of the program. And if you're interested in finding out more details about any of these projects or how you could get involved, please request to join our mailing list. And there's some, we have contact details at the end of the slides to share with you. So there, just to show you that, you know, for each of the work streams, this one being the example for disease prediction, we have a variety of projects that are happening, including things like cardiovascular risk scores, repurposing those for other diseases, or looking at how a diabetes diagnosis could impact future outcomes. The second work stream around interrelationships between diseases are, as I said, looking at interactions between different diseases. So non-cardiovascular diseases associated with cardiovascular disease or stroke, thinking about risk factors across multiple diseases and how they interact, potential of other association of long-term conditions following diabetes diagnosis. These are some examples. And then finally, thinking about inequalities, we are looking at things like social determinants and how they impact cancer, cardiovascular disease screening, and people with severe mental illness, or looking across the population at the level of spend and resource use for cancer care. So I'm conscious of time, so I think I have about 5 minutes left before I need to hand over to Amy. So I wanted to share a few things about the data use and where we are in the data access process for this program. So as I mentioned a couple of times now, we're looking at data across various sources, and we want to cover the entire UK population, and we'll be accessing the data within secure data environments. So the way that we've approached the data access approvals process is we've had the fellows and the students design their research questions. They've identified the necessary data sets that they need to conduct their research. We've put together a draft protocol describing the overall research program and giving some examples of those individual research questions and projects that we would like to address. Our protocol has had public contributor input, and we've had public contributors help us to draft a lay summary describing the research in the protocol. And we're about to submit our ethics application to the National Research Ethics Committee. Then the step that we're almost ready to complete is to receive approvals within by the individual secure data environments. So these are specific and separate information governance approval processes that we need to go through each of the secure data environments. So I think I've hopefully given Amy enough time to complete her slides, so I'm going to hand over to her.
Thanks so much, Alexis. I'm sure we'll get through it. So yes, as I mentioned at the beginning, I'm the PPIE manager for the programme. So I support involvement and engagement of patients and the public within big data for complex disease. Next slide, please, Alexis. So one of the really important parts of us working closely with public and patients is that we build a trustworthy relationship. And in order to do that, we want to act in a way that is trustworthy. So we're really using these three components here in hopes to show that we are a trustworthy programme as well as wider organisation. So firstly, that's showing that we're competent, that we have the expertise, skills and methods to access, manage and analyse the data accurately and meaningfully in a way that's beneficial to patients. To be honest and being transparent in our communication, acknowledging where there might be uncertainty or limitations, and being reliable as well. So being consistent in this communication as well as our actions in hopes to build a strong relationship with patients and public that allows us to work collaboratively together, which brings me on to the next slide, please, Alexis. So working with researchers and patients and public, we have developed a strategy that outlines 4 objectives to help us deliver patient and public involvement and engagement. I'll call it PPIE from now on for short, to help us work closely together and embed PPIE throughout the programme. So we tried to keep these objectives quite broad, earlier when Alexis showed the program sort of map, you'll have seen that green box. So this strategy is trying to encapsulate everything in that green box. So supporting individual researchers and research projects, but also any future deliverables within the program that go beyond that. So we wanted flexibility in our approach, so we can really meet the needs of patients and public as they arise. So the first objective was the easiest one to decide on and probably the most difficult to deliver. And so a lot of our time and energy and focus is going here first, which is to embed PPIE across all areas of the programme. We know that this will strengthen and improve the quality of the research, the relevance, the impact, and ensure it's beneficial to patients and the public. So we're really looking at doing that through a variety of methods. Firstly, by working closely with the researchers to ensure they feel supported and confident in delivering PPIE within their individual projects, and building a diverse network of people engaged in those projects and the wider programme. And then secondly, we're looking to engage and involve diverse audiences through innovative methods. So really ensuring an inclusive and accessible approach to PPIE. And really by that, we want options, different opportunities for people to get involved. Some people will be really interested in the really detailed, quite specific research projects. Others will maybe be more interested in the general programme and what aims and outputs it delivers. So really providing different opportunities to hopefully engage a wide audience of people. And we also want to ensure within this objective that we're doing this using a trauma-informed approach. And what I mean by that is that patients and public involved and engaged in this programme feel nurtured and empowered to get involved. It's a safe space and it's their choice how they want to get involved. When we're talking about complex diseases, as well as some of our other aims, such as risk and inequalities, these are difficult topics and they have people's lives behind them and they can be traumatic experiences. So we want to ensure that all our work is done in a sensitive way that doesn't cause further harm, and we're working closely with our researchers to deliver that. Next slide, please, Alexis. So then, can't see it yet, there we are. So the third objective is then taking a collaborative approach to PPIE, sharing knowledge, insights and learnings. So as Alexis already mentioned, we are one of 5 driver programs and we are all about interdisciplinary working. So we want to ensure we're not doing anything in silos separately, that we're connected and really learning from each other. I'm also part of the central PPIE team within HDR UK. They also have their own networks and objectives, so it's always checking in with each other, where can we collaborate? And then beyond the organisation as well, looking at the universities we're linked in with, the volunteer and community sector, where are these opportunities to collaborate and reach new people? And then finally, number 4, although it sort of might be seen towards the end, we want to be considering this now. Can we create long-term impact, particularly considering how we disseminate the outputs of the programme in a way that is collaborative with public, healthcare professionals and policymakers all together. So we want to ensure the communication of our research outcomes is done in a way that's beneficial for those who it's most going to impact. For example, risk information is really important, that we work and collaborate with patients and the public when we're communicating risk information, because that can be quite scary information to receive, and we want to do it in a way that is sensitive and doesn't disengage anyone from our work. So really considering all stakeholders to support a successful translation of research into practice, so we can ensure it really does benefit patients' lives and the public. And that is the strategy, and I believe we're into questions. And yeah, I think our contact details are there at the end, so we'll just say if anyone's interested in joining our network, feel free to email me and I can add you to our mailing list.